Well, gentlemen, glad to see you this morning. Welcome to the Speak on Alzheimer's disease. Okay, well, let's get rolling, right? Okay, all right, presented today for educational purposes. Discuss any specific health problems that you feel comfortable with your doctor. I'll be available for questions as well, during and after. All right, so today we'll discuss Alzheimer's disease, the causes and risk factors, symptoms and warning signs, diagnosis and treatment, minimizing risk, and supporting brain health. Well, this is all good and dandy and it's all important, but at the end, I've got something else. So hang on. All right, what is Alzheimer's disease? Brain disease, right? Pretty much relegated to just your brain. It's caused by cell damage that affects your memory and other brain functions. It is progressive, which means it keeps going forward, and it's not a normal part of aging. So, let's talk about that for a minute. There's something called an occasional memory loss that is not dementia, and then there's dementia. The difference, one of the main differences is when you have that benign occasional memory loss, lost my keys, right? Something like that. If you recognize that you lost your keys, it's most likely not Alzheimer's, right? But if you don't remember and you don't have a knowledge of things that were going wrong, it can be dementia. Y'all kind of get the difference? Yeah. Okay, so causes, not fully understood. Proteins build up within the nerve cells. So there is a scientific explanation, right? And I'll give it to you. So there's amyloid deposition, neurofibrillary tangles, basically the connections between your neurons, the ones from the first order from the top of your brain that come down, they're choked. They're choked with proteins, with gunk. And then they're also twisted up a little bit. Well, when that happens, they don't get their nourishment. They don't connect. When they're not connected and they're not used, what happens to the brain when it's not used?
It does.
It goes away. That's absolutely right. So I'll give a good example. In the development of humans, if you don't see out of both eyes, that part of your brain goes away, meaning it doesn't work. So same thing here. If you're not using it and the brain tissues are not healthy, they go away. Cells start to die, right? We just spoke of that. And the brain shrinks. And it starts in the memory area of your brain and spreads to other areas. So what are the risk factors? Age, family history, gender, right? So as we get older, perhaps you've had a family member that you remember that may have had dementia. Lifestyle is important. What would be a lifestyle that might be predisposed to Alzheimer's dementia, where the brain cells die and the brain shrinks? What lifestyles? Alcoholism. Bingo. That's probably in our country, our area of the country, probably one of the more important ones or the more major. What else?
Sleep.
Sleep. Poor sleep hygiene. Bingo. I've got it too. I was up 3 or 4 times last night. I know. What else? Wow. What a big one. Social isolation. You know, we're all prone to that as we get older. Whether you have disease or not, we're prone. That's our human condition. But when it goes on too long, those areas of the brain that were functioning in that area, they go to sleep. And it adds to the problem. What other things might cause, a lifestyle that might cause it?
Sex.
Okay, gender, that's right. More often in what? Males and females, maybe? What else? Smoking. Wow, that's exactly. What does smoking, how does it damage the body? What's the major damage to the body in smoking?
Lungs.
Okay, it can't damage the lung. But how can smoking affect your brain? Of course, poor lung function, that's exactly right. What does smoking affect besides the lung? Huh?
Clogs you up.
Yeah, who said blood flow? Bingo. Okay, so arteriosclerosis or atherosclerosis. See, your brain needs a good, laminar, symmetrical, smooth flow. If you're smoking, the lining of those blood vessels that go to the brain, the endovascular lining of your artery, gets damaged. When that gets damaged, plaque builds up, causes blockages. And of course, that gives us what? Not only stroke, but brain damage. I'm going to give you another area. Who remembers Cassius Clay? How could his lifestyle contribute to what happened to him?
Getting hit a lot.
Yeah, he kept getting in that, getting in the head, beating in the head.
That's right. Maybe he didn't do the rope-a-dope too much or enough, huh? Okay, so head trauma, right? Come on in, gentlemen. Don't be shy. We got plenty of room. Come on in. Can y'all hear me? Okay. If I'm speaking too loud, just do that. If I'm not speaking loud enough, just and way y'all can.
Doing great.
Yeah. Well, thank you. Y'all can prompt me. Okay. All right. Well, welcome to the folks that just came in. What we were speaking to are the risk factors for Alzheimer's, well, dementia in general, but especially Alzheimer's. And we were talking about Cassius Clay. And Cassius Clay later became,
Muhammad Ali.
but what happened to him later?
He got dementia
He got dementia. Yep.
from getting the blows in the head.
From the blow. So every time, who was his big competitor? I can't remember. Frazier, the Thriller in Manila, right? Every time Frazier hit him with a hook, his head turned. When it turned that hard, it blocked off the blood flow to the base of his brain. Okay, and that's what takes a boxer down. That quick movement to the side, from a blow from either side, it robs the brain of oxygen for that moment, and you go down. The brain does not have much of a safety tolerance. So, what's the point? Sports. So it's a lot of sports. Football. Now, y'all correct me if I'm wrong. I heard that in soccer, you can't do the headbutts anymore with your,
You mean with the ball?
yeah, hitting your head and going.
Oh, I don't know.
I don't know. Huh?
I've seen him hit the ball.
Lately, recently, I might be wrong. I thought I heard that somewhere. But that would be a mechanism too, right?
Game in a while.
Yeah. So,
Head scores more goals than probably foot.
yeah. Excellent. All right, let's keep moving. Lifestyle, not managing your health conditions. What health conditions that are unmanaged could be damaging or devastating to the brain?
Apnea, man. Not sleep apnea.
Yes. Wow. That is one of the number one. What happens in sleep apnea?
You gotta wear a mask every
Yeah. Well, there's two types of sleep apnea. There's central and peripheral. But either way, what happens is the soft tissues of your aerodigestive tract, your trachea, your pharynx, they get relaxed to the point where they drop back down into your airway. So it causes an intermittent obstruction. And you're sleeping. So do you know about it? No, that's the danger in it. That's the terribleness. So when those tissues drop back and blocks you from air from movement, what happens?
You stop breathing.
Intermittently, and then you get loss of oxygen. So basically, you're suffocating your brain at that time. Suffocating the brain results in damage. And damage results in dementia for some folks. And that's not the,
Mask every night.
wear it. That is, you're the poster child. Stay with it. Tell everybody that. That is awesome. So obstructive sleep apnea. What about diabetes? Not controlled. That'd be another one, huh? Okay. So a mild cognitive impairment. So you start off with some mild cognitive impairment. Which of our citizens may have that from birth? Down syndrome. So they have more instance of dementia because they started off with less cognitive function to begin with, right? Dementia is a matter of degrees. If you start low, then it can get worse quicker, right? But if you have a high cognitive ability, you're more resilient. And that's going to get to something else here that we're going to talk about. Well, there it is, lack of mental stimulation. When you have a high cognitive ability, you have more resilience rather than somebody that doesn't. And so mental stimulation is very important to keep those areas of the brain active, functional, purposeful. Symptoms may not appear for many years. I gave this example before. I took several church mission trips to Mexico. And one of our missionaries is a very smart man, high cognitive function, absolutely, a pilot. I noticed something strange one morning when we got up for breakfast that I couldn't quite fit into his character. And I sensed he might be starting with dementia. 10 years later, he was diagnosed with dementia. So they may not appear for many years is the point, right? All right, so symptoms of memory loss, right? More complex symptoms over time. So not only does the memory, the connectivity between the frontal lobes and the deeper structures, that connectivity gets lost, but also other complex systems that have to do with your autonomic nervous system, breathing, digesting. It just becomes a cavalcade of more and more problems that not only affect the memory, but your body's physical functions. The symptoms can vary. They can vary greatly, right? Alzheimer is largely a difficult diagnosis to make because it has so many components to it. But it's also a difficult topic to discuss with a patient, right? Nobody wants to hear that word. Nobody. Early warning signs, memory that affects the day-to-day living. So, what we're speaking of is our daily activity levels, or ADLs and IADLs. These are things like paying your bills, washing your clothes, preparing a meal. So those things get to be difficult. Ability to complete typical tasks. It might be brushing your teeth right. Clarity of time and place. So the victim of dementia is disoriented to begin with. They're disconnected in a way that their sense of reality is altered. And what I mean by that is time, place, person. Those things begin to get confusing and then lost for the dementia patient. So be aware that time and place is one of their greatest difficulties. And then vision. All right, so what are the early warning signs? Spoken and written processing. So you might notice that the writing gets a little bit more jarbled or whatever, jarbled. And their speaking capabilities, tasks, their word vocabulary may diminish. They may not be using the same words that they used before. They may not make complete sentences, right? All right, judgment and decision making go away. That's easy enough. Social interactions are very important. So as humans age, this is a human condition. This is not just dementia. We are at risk of decreasing our social interactions. Not everybody does it, but we're at risk for it. But in an Alzheimer's patient, a demented patient, that decrease in social interaction is especially difficult for them. And then finally, personality. You may see some personality changes. They may not be as interactive with you. They may change their mood quickly. I call it flipping a switch. Diagnosis. So, how do we diagnose Alzheimer's disease? Is it a blood test? Is it a scan? No. It's evaluation. It has to be the human touch. A qualified physician who's able to put together the whole picture. Now, what I mean by all this is if somebody's thinking you got memory loss, the answer is not to send you straight to the MRI. The answer is to get more information. And some of the folks that give the greatest amount of information and the most important information are the supporting family members and friends. So remember that. If somebody's demented, they don't necessarily know, right? We talked about that. So they can't report on themselves enough to give you a definitive answer. But it's when family members also speak about this in ways that it looks like that pattern, that's very powerful. But now remember that dementia is not just a loss of memory, because we all have some loss of memory, right? Here and there. Like I lose my keys sometimes. There you go. But that's not dementia. And why is it not? Because you know it. You know you forgot about that, right?
Think about it and then go back in and do it.
There you go. And you know about it. So you're cognizant of it. So it's just a little brain glitch for a moment. That's not dementia. So I want y'all I want to be clear in what your expectations of that disease is and not to scare you. It'd be easy to scare people. Oh, I lost my keys. We got dementia. No, that's not true at all. Okay? So dementia is a more complex illness to diagnose, but mainly the problem is it affects the functionality of the patient. It's not just some memory loss, but it has to have an outcome, and loss of function is one of them. And the function is driving, walking, doing tasks in the house. Let's see, physical and neurological exam. So, dementia does require a fairly detailed, comprehensive, and careful examination. And here's why. Dementia itself doesn't have a blood test. It doesn't have a label. When somebody comes into my office, they don't have a way, or I don't have a way to say, oh, you're demented. It's a complex combination of things. So the physical part of it is, do they have some other anomaly going on? Do they have a vitamin deficiency? Do they have alcohol poisoning over time causing neuropathy? Do they have Parkinsonism, right? So the physical exam and neurological exam are important, and then there's testing to rule other causes. So we talked about that, alcohol intake, drugs maybe. And I'll tell you a little quick story about my training. So at Tulane, we were connected to Charity Hospital of New Orleans. Anybody know where that is or who that is? Yeah. For your heart?
Yeah.
Wow, that's good stuff.
Dr. McKinney.
Well, I know him. I've been in his... What? I didn't know that. But I've gone in with him for ablations. So anyway, moving forward. So at Tulane, the old Tulane and Charity Hospital system on Tulane Avenue, we had a special building called the Dybert Building, and it was largely for infectious disease. And one of the biggest ones in the last century was syphilis. We don't see it that much because we have much more access to health care. We're much more cognizant of it based on what? News, feeds, information you can get hold of. And then people have changed their behaviors largely based on the knowledge of the outcome of what this can do to you. So anyway, we want to test for things to make sure that there's no vitamin deficiencies. There may be no Lyme disease, if that was a concern in a hunter. No syphilis, somebody that might be a sex worker or somebody that had casual sex. It's a combination of things that helps us with the diagnosis. Anybody have questions about that?
If someone remembering, you know there's tasks you're supposed to do, but you don't know what you're supposed to do, or you know you're supposed to be finding something, but you have no idea where to start. Where would be a more likely issue of that?
As far as the diagnosis?
Yeah.
So, I mean, you're certainly describing something that this person has forgetfulness, right? Well, that's one of the foundational diagnosis symptom characteristics that we use. However, if that person knows that they're unable to do that task, if they're aware that that request or requirement is in their life and they can't complete it, it might not be dementia. Remember, the difference between memory loss, benign memory loss, and dementia is the orientation of the person as to if they acknowledge it, if they know it. If a person knows that they're losing their keys, it might be dementia, but more likely not. It's the person that doesn't remember and can't describe something that happened that you know just happened or happened at some time in the past, and they have no memory of it. That's where you need to get concerned the most.
How does the, all of this stuff, maybe getting ahead of myself, but how does it lead to the morbidity?
Huh. Wow. What a good question. So my wife and I were talking about this. She's certainly my partner. We were going through this, and that's the question she asked me, which you just said. How does dementia kill people? Does loss of the brain function itself put you to death? It's the consequence.
It shouldn't.
It should. Now, I guess if you've been demented a long enough time, I mean, maybe so. But usually the death is from something else. One of the greatest causes of death in a demented patient is a fall, with a consequential hip fracture, femur fracture, arm fracture, maybe a blunt head injury, right? So hip fractures used to be deadly for the most part. I'm talking about 50, 100 years ago. But science, doctors' training, techniques, technology has advanced greatly. And so when you get a hip fracture, most of us don't succumb to it. But here's the problem. So you get repaired and you get up again. But for the demented patient, their brain is shrunken and their motor skills have gone down. So they're going to get the hip replacement, but guess what? They're not going to get up. They're not going to be able to get up and walk like they used to. That is a problem in the sense of pneumonia, aspiration, urinary tract infections that cause sepsis, bacteria in the blood clots, right? So it's the consequences of the effects of dementia that largely kill the person.
Sir?
Go.
I don't think you mentioned, and maybe it's not connected, but if someone loses their hearing ability, often it affects their social interaction.
Wow.
And I'm basing this on people that I've known through the years, and they weren't born deaf or something. Maybe they have a different, whatever. But anyway, if they've lost their hearing, they lose their social abilities, and is that memory loss or is that Alzheimer's? Or neither?
I'm not sure. They've got hearing loss.
Yeah.
And what's...
Well, I'm saying that because they have developed a hearing loss, they become more antisocial.
Okay.
And then they isolate themselves more.
Right.
And then they start acting differently than they did.
You know, the question is excellent, and it's like a dance, right? Between two dancers. Can you separate them in that dance? No, then you don't have a dance. The hearing loss certainly puts you at greater risk of social isolation. Who here has hearing loss? I got it. It's pretty prevalent as we age, right? The main take home of that is, for me, is that puts anyone at higher risk of dementia because they lose that social interaction, challenge, and spark to that part of the brain. So that part of the brain goes to sleep. Well, that then causes more problems. It becomes a spiral. So it gets worse and worse. What's a good way to correct this?
Hearing aid.
Hearing aids. And hearing aids have advanced greatly as well. And so let's keep moving. All right, so there's no cure. You need to talk to your doctor. If you're concerned about dementia or somebody having dementia, bring in family members that can do testimonies or make statements about what it is their concern is. The patient, if he's demented or she's demented, they're not going to be able to tell you that I'm not remembering, because remember, in dementia, they don't know that they're not remembering. So interviewing the patient alone is not the answer. You've got to get peripheral around them, people around them. All right, so it's not preventable, but certainly there are things that you can stop doing that stops putting you at that risk, right? Or as much of a risk. So if Cassius Clay wasn't quite as talented and successful, he might not have developed it because he might have gotten out of the ring, right? Take care of overall health, exercise, diet. Manage conditions like diabetes. That's so important, y'all. So important. Systemic illnesses like diabetes, some types of things like lupus, all that you need to manage it. Support your brain health. Brain health functions are motor, we talked about that, walking, sensory, touch, tactile, understanding where you are in time and space. And that goes to things like putting on your clothes, walking, emotional health functions, and then cognitive, the thinking part. So all of these areas can be damaged or at risk. And they can happen at different times, not all at the same time.
What was the last note, like 2 pages, I think it was a page before that. Okay, thanks.
Support your brain health. How do you support brain health? Who knows that answer? There's a lot of ways to do it, so you're not right or wrong. Social interactions, education, studying topics. Go ahead.
I'm not really sure if this works like that, but I used to do Sudoku a lot.
Used to what?
Do Sudoku a lot.
Oh yeah, Sudoku. Yeah, that's excellent. That's exactly what we're talking about. Puzzles, challenges, a new language, a new hobby, all of that supports that part, right? So, how the brain changes. Well, knowledge accumulates because we have experiences. However, certain areas of the brain shrink. Communication among the brain cells change. We talked about that, the amyloid plaques. And then finally, inflammation may increase. Supporting brain health, maintain physical health. Preventive screenings with your doctor. Manage existing conditions, your diabetes. And of course, that's what we do at Primary Care Plus. When you come into our office, we don't see diabetes, we don't see heart disease, we don't see kidney failure. We see the person. And we want to know how to connect all those parts to optimize your health. All right, so focus on, so good foods would be things like legumes, white beans, red beans. Anybody here eat red beans on Monday? Hello. Now, I grew up in Thibodeau, and they had white beans on Monday. That was the Cajun twist to it. Okay, so green vegetables, fatty fish, perhaps salmon, berries and walnuts. Supporting brain health. Find meaningful activities. So I just joined my church's Bible study class last week. And that's a completely different place and time and structure than anything else in my life. So it opens up new avenues, new pathways, new opportunities to interact and be socially active as well, right? All right, learn a new skill or activity. Just spoke about that. Supporting brain health, find meaningful activities, move your body, engage with the community, like I did. Create habits to de-stress. Train your brain. Brain can continue to grow with age. Train for growth and activities that are challenging, complex, and require practice. Now, that's a little bit, for me, a little bit controversial in the sense that you don't want to give yourself such a task, especially a demented person, that it frustrates them. So pace yourself, find things that are challenging but not impossible. So be careful with that. Alzheimer's disease affects the brain and memory, of course. It's progressive. It gets worse over time. It says pay attention to symptoms, talk with your doctor, and take steps to support your brain health. And that's things like avoiding head collisions, undue amounts of alcohol, certainly staying away from things like cocaine that damage the arterial lining. Questions.